Dr. Ankita Baidya, Consultant Infectious Diseases at Manipal Hospitals, New Delhi. These days I'm getting a lot of queries about black fungus. So black fungus is nothing else but mucormycosis. We can say it is synonymous to mucormycosis. Mucormycosis is not a new fungus. We used to see earlier also as a complication of diabetes. Diabetes patient used to get mucor infection, especially around the sinuses or eye, or sometimes in the brain. This time as a post-COVID complication because of the use of steroids, uncontrolled sugar during the treatment, or because of the use of humidified oxygen as a requirement when the patient is not able to maintain oxygen saturation during the COVID infection. The use of oxygen therapy is there. So all these add on as a risk factor to acquire this infection. Why it is called black fungus? Because it's a fungus infection, and wherever this infection is there, the tissue turns black, and so it is very commonly and nowadays talked about as a black fungus. But it is not only the mucormycosis. Sometimes there are other fungal infection also, especially in the cases of post-COVID infection like aspergillus or other hyaline fungal infection that can be seen as a complication in a post-COVID patient. The symptoms of this disease depend upon which organ is involved. So if the case of this black fungus is involving the sinuses, which is the most common part of the body or that is affected, the major symptom that a patient will complain is of the nasal congestion. Sometimes there could be swelling around the eyes or around the nose, could be redness or pain. Headache can also be complaint, change in vision, or sometimes double vision. These are the common complaints that a patient can complain if they are having a sinusitis or a fungal infection. Sometimes jaw pain can also be seen. So this is all about if the patient who is post-COVID and having symptoms of rhino or vital mucormycosis. Headache can be seen, seizure can be seen in cases of cerebral involvement, brain involvement of the mucor. Lung involvement with the fungus can give you a prolonged cough, sometimes blood in the cough. So if any such symptoms are there, it is advisable that you should meet your doctor to get the advice and proper screening test run, that if this fungus is there, the timely treatment can be provided to you. So the important part is now how we can prevent this infection. So important, as I mentioned, that the risk factors are diabetes. So you should keep a strong check on your sugar, and that should be controlled very well despite you are on steroids. So that should be tried, that the sugars are very well controlled. A strict diabetic diet has to be taken, and if the oxygen requirement is not there, don't put on oxygen therapy if it is not advised by your doctor, because such oxygen can be harmful to you if it is not required and you are maintaining good level of oxygen saturation. Apart from this, whatever water that is being used for the humidification of this oxygen, that has to be a distilled water. Tap water should not be used. And if we see other than this, if the dose of steroids, it's should be used as a minimal dose, whatever dose is required for the adequate treatment, and higher doses should be avoided. Even this holds same for the immunosuppression also. If it is not required, it should be used judiciously. So if we take care of all these aspects regarding the dose of steroids, the immunosuppression, the sugar control, and the humidified air has to be from the distilled water, and proper infection control practices, I must say the risk of getting a fungal infection can be minimized significantly.